I use this opportunity to thank the organizers of Third International Conference on Artificial Intelligence and Logistic Engineering for giving us an opportunity to present our work titled Application of Support Vector Machines to Lassa Fever Diagnosis. I am Chinechirem Umezurike, and I'm presenting on behalf of my co-authors, Wesel Nwankwo, Wilfred Adigwe, Ijiagwa David Achibe, Chukwemeka Nwankwo, Emmanuel Oje, and Duke Ahoridan. The healthcare delivery sector has continued to suffer setbacks in providing quality healthcare services, especially in developing countries. Quality connotes fitness. Quality healthcare entails correct and accurate diagnosis and prompt treatment with a function of right and accurate clinical decision-making, which, if neglected, can lead to disaster and loss of lives. And this task depends on the physicians making the diagnosis. Data obtained from medical data obtained from medical environment are so enormous, and some of these data are signs, symptoms, and laboratory tests. And to analyze before arriving at the correct diagnosis, they might be enormous and at times unimaginable. Machine learning and deep learning have proved reliable and efficient in most socioeconomic spheres, especially in prediction and in precision prediction from historical data. And integrating it to healthcare will go a long way in helping healthcare specialists make diagnostic processes more objective and more reliable. Lassa fever, an acute viral disease with a cycle between 2 and 21 days, was discovered in Nigeria in 1969. And it is transmitted from human to human, where most often results to epidemics with very high case fatalities, as high as 60%. Early symptoms of this disease include fever, sore throat, cough, and late signs include bleeding, coma, convulsion, as the case may be. This study aims to develop an intelligent diagnostic model for Lassa fever diseases. Specific objective is to design a machine learning model that can serve as a decision support system and implementing the designed model for the diagnosis of Lassa fever using Python programming language. Methodology: clinical data set was obtained from the epidemiological unit of a specialist hospital designated by the Nigerian government for management and research. Then this data contains 1,728 records. The data was cleaned. The data was split into 80-20 ratio for training, testing, and evaluation purposes. This is shown in figure 1, which is the methodology, critical approach that was used in arriving to in actualizing the objectives of this work. The data collection, as mentioned, the data collected was unstructured with some columns not required, and such columns were removed from the data set, and the useful features selected for the Nation-Malin model. Now, some of the features selected are the body temperature, the body pain, vomiting, jaundice, bleeding. And some of these are some of the symptoms that a patient shows when infected. Now, the data processing stage, the raw data was transformed into a machine usable format. The data set was also labeled and encoded. The resulting data set was more reliable and fit for knowledge discovery. And the symptoms that are manifested by the patients forms the input variables. And these symptoms are transformed into 2 classes, yes and no. And the target operative variable is a diagnosis of suspected Lassa fever, which is a binary classification. And this is the input transformation, where we have 3 domains. And in the domain 1, we have, if it is positive, we have yes, and it's coded 1. And if it's negative, we have 0, and it's coded 0. And this is done for all the symptoms that that is found when a patient is infected. The use case diagram was used to understand and identify the operations and users' role in the entire system, as well as showing the relationship between the user and designated functions. And some of these designated functions are loading the data set, viewing prediction results, analyzing and making decisions. And the person that does this is the medical personnel. While the support vector machine, which belongs to the supervised machine learning algorithm, was used for regression and classification problems. Then it was used to plot each data item as a point in a number of dimensional space with the value of each feature represented by the value of a coordinate. Classification is performed by finding the hyperplane that most distinguishes the two classes. The X is the features and Y is a number of vectors. Since there is a number of training data sets, given that training variables X and output variable Y are defined by the 2 equations, equation 1 and equation 2. Equation 1, where X belongs to a set of X belonging to real numbers. The support vector machine algorithm is the function of Y and X that maximizes the error for all the learning features. Where W is a number of dimensional vector representing the weight, this determines the trade-off between the differences in the decision function. The proposed evaluation, the result of the SVM model, are evaluated by the prediction accuracy, represented by a confusion matrix. Other evaluation metrics are the area under curve, receiver operating characteristics that evaluates the number of true positives against false positives. And the exploratory analysis, referring back to the number of data sets, which is 1,700 records of patients admitted for treatment. And this is shown as a summary and description of data set relationship to the member variables, as shown in the figure. For more illustration, a pie chart showing the percentage distribution of Lassa fever is shown in figure 4. Evaluation matrix to establish the accuracy, as I've mentioned, we used the prediction accuracy confusion matrix, area under the curve of the receiver operating characteristics. And the model is also evaluated with the precision and recall plots, which is shown in figure 4. It's figure 6. It is the confusion matrix is a productive matrix for the problem of classification of machine learning, where 2 or more classes can be tested. It is a table comprising 4 different expected and actual value combinations. This is shown in figure 5. And the confusion matrix computation, where we have true negative 294, false positive 69, false negative 72, true positive 84. And the rates computed for the confusion matrix, we have accuracy for 0.75 value, 73 value, false positive rate 0.19 value, true negative rate 0.81 value, precision 0.55 value, and prevalence 0.19 value. This shows the precision and recall graph. Clinical decision support and intelligence system have a history of enhancing the efficiency of valuable socio-economic workflow. In this paper, we examine the applicability of support vector machine algorithms in dictation, diagnosis, and profiling of Lassa fever in patients using historical clinical data from a specialist hospital. The developed model showed that valuable insights could be drawn from historical data. The proposed system improves and encourages decision-making in this regard and would be a valuable tool in the hands of medics. The findings in this study notwithstanding, we recognize the limitation in the sense that the data set available was not detailed enough and also fall short of satisfying the adequacy metrics in terms of the volume of data available. However, we believe that this study would constitute a good cornerstone for conducting future research in the construction of hybrid models that could provide better results for Lassa disease diagnosis and management. Thank you for listening.